All right. Colleagues, we are now in session for our voting in Senate Finance, and we'll begin with Patrick.
The first bill for the committee's consideration today is Senate Bill 3. This is the...
I'm going to ask everybody to try to project, because since the public is listening in, perhaps, so they can really hear what we're doing. Okay.
So this is Senate Bill 3. This is the bill that expands coverage and reimbursement requirements for telehealth, for Medicaid and commercial insurance. You should have two reprints in front of you. One is a set of pretty extensive amendments, and the other set is an amendment that's being offered by Senator Reedy. I will go through the reprint that's in front of you first with the extensive set of amendments.
And who offered those? The extensive amendments, where'd they come from?
So these are amendments that I think the chair is offering for the consideration, for the committee's consideration. What it's reflecting here are there's a lot of work that's gone in over in the House in their subcommittee, and the bill largely mirrors what the House subcommittee has approved. There are some differences, and Senator Augustine has also been working on the bill and has had some work sessions with some of the proponents of the legislation and opponents to discuss some issues. So you recall that there is another telehealth piece of legislation, Senate Bill 393, and so some of those provisions, this is legislation that Senator Augustine had sponsored. Some of those provisions have been incorporated into this bill. So this bill has brought in some provisions from that bill. I will go through the reprint and highlight areas where there is some difference in the Senate bill with the amendments that are before you from where the House bill is. But let me start by just kind of explaining that this bill, in a way, especially the Medicaid section of the bill, the best way I can describe it is like fixing a stair, and you open up the stair, and then you realize that it's rotted underneath, and you end up having to do a lot of work to fix the statute. So in many ways, there's lots of amendments represented here, but once we got into working with this section of the law, there's some recodification and some revising that has needed to be done to fix up some cross-references. And so I'll try to highlight the places where we're really not seeing a substantive change in the law, but just a recodification. So the bill begins on page 4, and what we've done here, the amendments, is repeal sections of the Medicaid law that relates to coverage of telemedicine. A new section is being brought into the law that deals with telehealth. There was some conflict with some existing provisions that are in the code, and so those provisions are being repealed, and then they are largely being reproduced in this new section of the law that begins on page 5. There are a number of definitions here. The first one I'll flag for you is on page 6, the definition of a healthcare provider. This is going to be relevant because it relates to provisions that require reimbursement of certain types of providers when providing telehealth services in Medicaid. It's a pretty extensive definition of healthcare provider. It includes any person who's licensed, certified, or otherwise authorized under the Health Occupations article to provide health care in the ordinary course of business or practice of a profession or in an approved education or training program. It includes mental health and substance use disorder programs, persons who are licensed to provide services to individuals with a developmental disability or recipient of individual support services, or a provider of long-term care services. So in each instance, the way the law works is that a service can be provided by a provider as long as it can be appropriately delivered through telehealth. But this makes sure that if this is a provider who can provide a service that can be appropriately appropriately provided through telehealth, that they can be reimbursed for those services. Down here at the bottom, under the definition of telehealth, we have an expanded definition of telehealth that must be reimbursed under the program. Importantly is coverage of audio-only services. This has been one of the more significant points of discussion between providers and payers throughout the deliberations on this bill. What the bill does is it says that for a 2-year period beginning July 2021 to June 2023, Medicaid has to cover an audio-only telephone conversation between a healthcare provider and a patient that results in the delivery of a billable covered healthcare service. And so I think the balance that was struck, the aim of the balance here is to have pretty comprehensive coverage of audio-only services like we've seen during the pandemic months for a time-limited period for 2 years. And during this time, and we'll see this later on in the reprint, there will be a study that the Healthcare Commission will be doing to look at all the ways that telehealth has been used and make some recommendations. So it's a time-limited requirement to cover audio-only services. The bill also requires coverage for Medicaid remote patient monitoring services.
There's a word that's synchron. Yeah, right above the section that you was just referring to, that's synchronous. So, what is that word?
Yep. So that's actually doesn't represent a change in the law. It's just it needed to be restructured, that provision. But synchronous is real-time interaction like we're having right now.
Got it. Thank you.
Moving to page 8. Here we get into some of the places where we have new provisions and some provisions that are just being recodified, essentially. This requires the Medicaid program to provide healthcare services appropriately delivered through telehealth to program recipients, regardless of the location of the program recipient at the time telehealth services are provided. So in the past, it has been the case that there have been restrictions on reimbursement based on where the patient is located, like the patient would have to be in the clinic. This lifts those originating site restrictions so that it's not a requirement anymore that a patient be in a particular location. So, for example, if somebody is at their home and they're receiving services that can be appropriately provided to them in that context, reimbursement would be provided. In addition, this says that when providing, this says also that the program must allow a distant site provider, and this would be this would be the provider who is not with the patient but providing services remotely through a telehealth interaction. That provider, they have to allow a distant provider to provide services to a program recipient from any location at which the healthcare services can be appropriately delivered through telehealth. When Medicaid, when providing the services required here, they have to allow a program recipient to select the manner in which a healthcare service is delivered as clinically appropriate under the Health Occupations article. A similar provision like this is located in the insurance coverage section of the bill, which is later on. But I do want to flag this for you because this is one of the areas where the Senate bill is including a provision that the House bill, it appears, will not be including. This is a patient choice provision.
Where is that, please?
This is on page 8, subsection B3. So the rationale for this provision is that there is some concern that maybe a plan might offer a design where certain services would only be made available to a patient through telehealth. And so that's one context. They want to make sure that, that carriers, when providing a plan, would ensure that a service would be available to an individual in person if that's what they wanted. Additional context is, and this is particularly relevant for behavioral health, where there's been a lot of discussion about this, is if you have certain types of network adequacy requirements, that you're able to get an appointment within a certain amount of time or within a certain distance of travel. There's been a lot of debate about whether an insurer would be able to use access to a telehealth appointment to meet that type of network adequacy standard. So if someone wanted an appointment and there was a requirement that they get an appointment within 7 days, for example, that a carrier might not have a provider available, but they could say to an individual, but we do have someone who can meet with you tomorrow if you're willing to do that through telehealth. The challenge is that that carriers, I think, they want, this is part of a broader discussion, but they want to be able to manage their narrower networks and have the ability to meet some of their network adequacy requirements through the use of telehealth. But many of the providers are concerned about that because they perceive that there's a need for inclusion of more providers in network so that patients have more ready access to service from providers. So the MIA has convened a process where they've been reworking regulations, and the current status of the regulations is that you can't count a visit that's through telehealth when determining whether you're meeting your network adequacy requirements. But there's a proposed rule that's under consideration that would allow that. So there's some apprehension about this provision that carriers have expressed that should be a part of a broader discussion. But proponents of this provision say that it's a matter of patient choice, and it's a protection that they want to include. A related provision is listed below, and that's a requirement that the program that Medicaid require a program recipient to use. That the Medicaid program may not require a program recipient to use telehealth in lieu of an in-person service delivery. So these provisions apply to Medicaid. They also, later on in the bill, apply to insurance carriers, and it's the insurance carriers who have been raising concerns and have been a part of this process before the MIA. But so that the requirements are applicable and similar to both Medicaid and insurance, they're reflected here in the insurance requirement or in the Medicaid requirements. In addition, now there's some provisions below that largely are recodification of current law. That would be subsection E, F, and G on page 8. Going to page 9, this is generally a recodification of current law as well, up at the top. There's something new when you get into this paragraph 3 on page 9, and this has been the second point of pretty significant difference between providers and payers who've been working out the bill. And this is about reimbursement parity between an in-person visit and a telehealth visit. And so, like audio only, the compromise has been that for a 2-year period, from July 1, 2021 to June 30th, 2023, when appropriately provided through telehealth, Medicaid must provide reimbursement for these services on the same basis, telehealth services, on the same basis and same rate as if the healthcare service were delivered by the healthcare provider in person. And a similar provision like this is included in the insurance section for the insurers. There are some nuances here. This reimbursement requirement does not include clinic facility fees unless the healthcare service provided by a provider is provided by a provider who's not authorized to bill a professional fee separately for the healthcare service. In other words, if it's a provider who, say, is employed by a hospital and providing services through telehealth, and they are not able to bill a professional fee separately to get paid, and that's the only way that they get paid is through the facility fee, then that would be allowed. There's language down at the bottom, which says that nothing here may be construed to supersede the authority of the HSCRC to set the appropriate rates for hospitals, including the setting of the hospital facility fee for hospital-provided telehealth. This is ensuring that HSCRC retains their authority to set rates, but you should know that this policy has been the policy that they have applied for the hospitals that they regulate when setting charges for telehealth visits, is that they are not allowing facility fees in addition to a professional fee unless that's the only way that the provider can get paid. So there is alignment with this HSCRC policy and this provision in the bill. That's been what's been done during these pandemic months, and I think the rationale here is to continue to a certain extent the reimbursement policies that have been placed for this time-limited period. There's some study language that you'll see that will have the Healthcare Commission looking at this issue. So this is going to be a part of the discussion. Senator Reedy, did you have a question?
I may have a larger question in a minute, but I did wonder, what you just said, so HSCRC retains its ability to set fees. You're saying that they, right now, currently don't allow you to get a facility fee for a telehealth visit. But is that a pandemic? You said, is that a pandemic thing, or has that been going on longer? You said pandemic, I think, right?
That's right. That's a policy that they adopted over the summer when it was apparent that we were going to need
For a long time.
to have services provided through telehealth. It was happening at a pretty widespread, utilization was pretty widespread. So that is something they adopted over the summer.
But before that, you could get a facility fee in addition to the professional fee, correct?
I think that's the case. I'm not sure what the policy was. I just know that that's the policy that they adopted this summer.
Is that, so we're saying that that's the current, that's not really in the bill, though. That's just the current policy is what you're saying, or is that in the, I'm just trying to follow all of it. It's in the bill. Will that mean it's permanent forever, or will that mean until they change it?
For this 2-year period.
For this 2-year period, okay.
Yeah.
All
And
right.
I'm sorry that it gets very complicated.
No,
Yeah. I will have to say, HSCRC retains the authority to shape that policy for the facilities that it regulates. There are some hospitals that aren't regulated by HSCRC, like Shepherd Pratt or the DC hospitals, like Children's Hospital. And since they're not subject to the HSCRC's regulation, this provision is in here to ensure that that policy applies to them.
Okay, okay.
Just to get clarity on your response to Senator Reedy, so prior to the pandemic, if you were in a facility, they were able to charge this fee, or were they able to charge a fee using telehealth? If you were using telehealth, were these facilities still able? Were these facilities still able to provide you a facility fee?
I don't know what the policy was before they formulated it this summer. I mean, I think one of the reasons potentially, and I can try to get an answer for you, but one of the potential reasons is because we just hadn't seen this type of utilization of telehealth.
Yeah, absolutely.
Until these pandemic months, and so the circumstances prompted formulation of this policy. But I think the important thing to know is that they're not permitted to charge a facility fee in addition to a professional fee.
Right. Well, it makes sense, and the accommodation is only for 2 years. I was just curious. I just wanted to get clarity in the issue that he brought up. Is did they put this in place because they wasn't using the actual facility? But we could find out later. It's not that big of a deal. It's not a deal breaker for me. I just wanted to understand it a little bit more. Thank you.
Yeah, I do think that's the rationale. I mean, there are certain costs, that you aren't covering, when you're providing a service outside of the clinic setting. Senator Kramer, do you have a question?
I think mine is a more generalized question. This is a very large bill, big work product here. How is it that we've established HGOs may be on one track and we're not on the exact same track? What is the thought process there? And at the end of the day, how does that play out? Because they get the bill after we send it to them. If it's different, then they probably change it, send it back to us, and it may happen. Whole thing goes to conference committee. So
Say, since they did have theirs done, I thought it's so big, and we weren't really in intricate work on what to do from our end yet on ours. I thought it might make sense we could see if what they've done with some touching up or some amendments from us might be sufficient, because we were so far. The way we're working this year, with neither house is on the same schedule as the other. Nobody's handled any bills that have come from the other side, and we could still end up out of here and with a lot of stuff lost. I just thought this was such an important bill that we could see, since they had it ready, we were going to be voting tonight. And right now, we're on a schedule not to vote but once a week, which it was what administrations decided rather than us. So
I guess I still have this question. It sounds like Senator Augustine was working with them, and I thought that sounded like the initial goal was keep everybody on the same track. Are you saying they've already done the bill? I don't understand. Have they passed this out?
The House really has.
Huh?
And I just thought we could see if we want to start from there, because it's so big and we got so much on us in such limited time. And maybe we could make some additional amendments if it works. So we're almost through it, if we could just make a decision. Senator Augustine, you got some?
Yeah, I just wanted to respond a little bit to what Senator Kramer was saying. The House is working on it, and we have also been. I've definitely participated in some of the things that they're doing, but we have also been working in finance. I mean, we've been working on this as well, and we've looked to harmonize the two bills, as Patrick has said. And also work with the advocates on some of those things. There are going to be some things that are in the version of the bill that we're talking about right now, which are different. The House has kind of moved back and forth with theirs, by the way. They had something, and then it went back. So what we're trying to do here is establish, like he was saying, a pathway forward with some of the things that we think are important and get it out there. But we worked on it with them, a lot of them. There's only a few things that are different, but I think it's important for us to get this thing moving the way that the chair mentioned.
And that's what I was trying to get a handle on, was what is the thought process and the plan? And thank you for explaining that. Now I do understand. So I appreciate it.
Okay, I'll just proceed. There's one additional qualification regarding the reimbursement parity provision I've been discussing for Medicaid. That reimbursement rate does not include any room and board fees. This is something that Maryland Medicaid had requested. They were just concerned that it could potentially be construed to include room and board for some of the residential substance use disorder facilities, and the advocates, nobody thinks it should include room and board, but that's in here. We're back into some current law requirements. It's currently the case that the department can specify in regulation the types of healthcare providers eligible to receive reimbursement for services provided to program recipients. This language that is below in H2 is somewhat new. It's pretty broad. It says that if the department does this, if they specify the types of providers who are eligible to be reimbursed for their services, it has to include all types of healthcare providers that appropriately provide telehealth services. You recall that Senator Eckert had a bill earlier this year that that the committee passed out that wanted to make clear that these providers would include psychiatrists and psychiatric nurse practitioners providing these assertive community treatment services. This language is broad enough that it met the satisfaction of those providers who are looking for that requirement that they be reimbursed for their services. So in some ways, this bill, this particular amendment addresses the concerns that they might have had.
Reported right now, considering how many people are in a state of depression or other mental health problems because of the pandemic. Yes.
A new provision is in I, and this is a requirement that the program or managed care organization that participates in the program may not impose as a condition of reimbursement of a covered healthcare service delivered through telehealth that the service be provided by a third-party vendor designated by the program. This is also a provision that will apply to the insurers later on in the bill, but the aim here is that there's some concern that there might be new vendors like Teledoc that exclusively provide services through a panel of providers who do telehealth. And the concern is that carriers might start using these particular vendors and only allow access to services through them. So this would prohibit that. This reflects some amendments that address some concerns of the payers. And the health department is required to obtain any federal authority necessary to implement the requirements of this section, including applying to CMS for an amendment to any of the state's waivers or the state plan. So that covers the Medicaid part of the bill. Moving on to page 10, we're getting into the insurance article requirements. You'll see something very similar here that requires insurers to cover an audio-only telephone conversation between a healthcare provider and patient that results in the delivery of a billable covered healthcare service for this 2-year period. On page 11, this is a point of difference with the House. This provision that's included here, this says that a carrier must provide coverage for services appropriately delivered through telehealth, regardless of the location of the patient at the time the telehealth services are provided. So this is getting at that originating site. The patient is at home. It would require coverage of that service to that patient, though they may not be in the clinic setting. This also requires a carrier, when providing this coverage, to allow an insured patient to select the manner in which the healthcare service is delivered as clinically appropriate under the health occupations article. Again, this is that issue I was talking about before about patient choice and concerns about impact on network adequacy and the management of networks that carriers would be seeking. There's a clarification here that there's a provision here that prohibits a carrier, when providing this coverage, from requiring an insured to use telehealth in lieu of in-person service delivery. There's a clarification that the services they have to cover includes counseling and treatment for substance use disorders and mental health conditions. On page 12 of the reprint, we have this language relating to reimbursement parity, and it follows the language I described that applies to Medicaid, that for this 2-year period they have to reimburse telehealth on the same basis and the same rate as if the services were delivered by the provider in person, and that this rate does not include clinic facility fees unless the provider is not authorized to bill a professional fee separately. It retains the authority of the HSCRC to set the rates for hospitals, including setting the hospital facility fee for hospital-provided telehealth. It also has this prohibition on carriers from imposing as a condition of reimbursement that a covered healthcare service be delivered through telehealth through this third-party vendor designated by the carrier. So you'll see there's a lot of similarity. Now we get into some really tricky drafting parts of the bill.
Before you go further, Senator Jennings, you got a question or comment?
Just a quick question. page 11, line 16, when you talked about the location of the patient, what about the location of the doctor? Let's say the doctor goes on vacation to Florida, and, I call his office, or like he's on vacation, I'm like, I really need to meet with him. He's got his laptop with him in a hotel room, he brings it online and spends an hour with me, helping me. Would he be able to bill?
So that is an issue that's addressed for Medicaid, but it's not something that was included within the scope of discussions for insurance carriers in providing coverage. So the location of the provider is not addressed in this part of the bill regarding insurance.
Okay.
On the bottom of page 12, the health department was required to do a study relating to telehealth and substance use disorder services that would be no longer relevant because of the coverage requirements of the bill. So that's being struck from the law. And going to page 14 of the reprint, there's a requirement that the Maryland Department of Health revise its regulations regarding telehealth reimbursed by the Medicaid program to ensure that requirements for reimbursement of mental health substance use disorder services delivered through telehealth comply with the federal Mental Health Parity and Addiction Equity Act. This provision is something that the behavioral health providers were seeking. This is not included in the House version. And then finally, we get into the language that deals with the scope of the study that the Healthcare Commission is going to be doing. So this is on page 14. You'll see that there's a requirement that MHCC, in consultation with HSCRC, the Health Department, and the Insurance Administration, submit a report to Finance and HGO on the impact of providing telehealth services in accordance with the bill. The report has to include, this is due December 1st, 2022. The report has to include an analysis of the impact of the use of telehealth on disparities in access to healthcare services, including primary care and behavioral health services, whether different communities and patient populations have differences in take-up rates of telehealth services, and the comparative effectiveness of telehealth services in inpatient visits on total cost of care and patient outcomes. The study there must be a focus on alignment of telehealth services with new models of care, addressing opportunities for telehealth to improve patient-centered care, healthcare services for which telehealth can substitute for inpatient care while maintaining the standard of care. This part will include the use of remote patient monitoring for somatic and behavioral healthcare services. The study also is going to look at the impact of alternative care delivery models on telehealth coverage and reimbursement, an assessment of the efficiency and effectiveness of telehealth services and in-person visits that includes a review of research on the impact of different communication technologies on patient health, including patient retention rates and reduced barriers to care. There will be a survey of healthcare providers, a review of resources required to sustainably provide these services for the continuum of healthcare providers, including private and small practices. The study is going to have a focus on assessment of patient awareness and satisfaction with telehealth coverage and care. This is going to include availability and appropriate uses of these services, privacy risks and benefits, strategies needed to navigate privacy issues, barriers to care, levels of patient engagement that have been addressed by audio-only and audio-visual telehealth. Also, a review of the appropriateness of telehealth across the continuum of care, inclusion of clinic hospital facility fees and reimbursement for hospital-provided telehealth, and the use of telehealth to satisfy network access standards. So this issue will be looked at, the network adequacy one. The report has to provide recommendations regarding coverage of telehealth services and payment levels for telehealth services relative to in-person care. There's some language that says how MHCC is to go about completing this report, including some language specifying the use of a healthcare provider survey. They're going to do this in, I think they're going to do this in coordination with the health occupation boards. There's some intent language here that says that until the commission completes its study, the requirements of the bill and comprehensive telehealth policies essentially are supposed to remain in place. So this says that Medicaid must continue to reimburse providers for these services through audio only and audio visual in accordance with the requirements of the bill and all applicable executive orders and waivers, and carriers must do the same. The Healthcare Commission must use data collected from utilization and coverage of telehealth during this time period for completion of the report, and that the intent is for the state to use the report to establish comprehensive telehealth policies for implementation after the state of emergency is over and all of its renewals expire. So the bill goes into effect January 1st, 2021.
The only thing here that's not in the House bill is section 2 on page 14.
That's right. So that's not in the House bill. Also, I'll flag on page 11 this language that requires carriers to cover telehealth regardless of the location of the patient at the time the telehealth services are provided. That's line 17. That's not in the House bill.
Okay.
Below that, the provision that is this item, paragraph 1, item 2, that says that the carrier must allow an insured patient to select the manner in which the health care service is delivered. That's not in the House bill.
Okay. All right, Senator Augustine Fleitzman.
Thank you, Madam Chair. I just wanted to say that I wanted to thank Patrick because he put a lot of work into this, and I've worked really closely with him on a lot of these compromises. We did also work, as you heard earlier, we started out, there was a work group that tried to come up with some compromises between all of the parties that were involved. We did not get there. That work group did not get there. And so what was said at that time was we would each go our way. The House was going to then have it go to subcommittee. They were going to work on it. We were working on it. We continued to work on it over here after that to try to come up with a product that, was a good product, but that also took into consideration some things that we thought were important, including some protections for consumers, particularly around behavioral health, that are important. And I just feel really strongly this is a very good work product, and I would ask to move favorable on this as amended.
Second. Okay, removed and seconded. Is there discussion on the motion? Well, they said as amended.
So just one point of clarification. So Senator Reedy has offered as an amendment to offer as well. So this would be on the amendments.
Do you have Senator Reed's amendment? It's either on this one. All right, well, why can't we do this much? If this doesn't negatively impact his amendment.
Yeah, I think these amendments can be moved, and then Senator Reedy's amendments can be considered.
Okay. Okay. All right, so we've got an amended motion to pass this reprint as amended. Can we save some time since we got so many bills tonight and raise your hand if you're in favor of that motion? If you okay. All right, that looks unanimous, I think. All right, now you want to explain the additional amendment that Senator Reedy has.
Okay, so Senator Reedy is offering an amendment. You've got a reprint in front of you. Senator Reedy's amendment would provide that it would prohibit Medicaid from providing abortion services, including the prescription of a drug or device to induce an abortion, to a program recipient through telehealth. And similarly, for insurance carriers, carriers would be prohibited from including abortion services, including the prescription of a drug or device to induce an abortion when covering services that are appropriately delivered through telehealth.
Chair, may I just explain a little further? Thank you. So I'm offering this amendment because, I'm a big supporter of telehealth. I've been that way since I came to the General Assembly. I think it's, and I enthusiastically was supporting this bill. It did not occur to me that what we're doing with Medicaid dollars is we're going to be using taxpayer funds to subsidize abortive procedures. Obviously, someone's not going to literally have a live abortion over the phone, but there are drugs that are now being prescribed to have chemical abortions, and drugs like misoprostol and mifepristone. I'm not even sure if I'm pronouncing all of them right, but I've looked into them extensively. Chemical abortions are 4 times more dangerous to a woman than an abortive procedure in a facility. And again, this is something where we're talking about doing things over the phone and over a screen. I think it'd be very wise for us to be sure that conversation happens, and that happens in a doctor's office. Obviously, I'm opposed to abortion in general, but I understand where we are in this state and the position we're in. I don't desire to make this the whole issue about the bill, because the bill is a massive bill with big implications. But I do believe this would be a very wise amendment to say this is a little bit of a bridge too far, using taxpayer funds in this manner. But also, it's a product that could be dangerous for somebody if they don't have the right guidance and the right counseling in somebody's office. So I would move my amendment, Madam Chair, and ask for support.
Is there a second to the amendment? Are you seconding it? Is that a second? Yep. Okay. Then, in terms of discussion, I would just say this. This doesn't seem like what they really are aiming at. But let's say an essential worker at a bus stop is kidnapped and raped and robbed. If she wanted services and were suicidal because of what has happened to her, I'm not sure we want to use this bill to deal with imposing our particular point of view.
Madam Chair, if I could respond. Number one, anytime we've talked about stopping, restricting abortion access for using taxpayer funds, we always have a life of the mother and rape and incest exception. This is a little different because we're not talking about restricting abortion, period. We're simply saying not to do it with using telehealth. So I respect what you're saying, but this is something this isn't the Plan B. We're not talking about restricting somebody's access to like Plan B or something of that nature. This is more about a chemical abortion. So, I mean, I understand your point of view, but that's just my only response.
Frankly, I'm not a physician. I got a sister who was one. But I can't imagine that most people will just prescribe if they anything that is a surgical procedure, if that's what you're talking about, or you're talking about and not to have the patient present. But also, I'm not sure that right now we want to make a blanket statement about something that's probably highly improbable to even happen, but to do so at a time that in the middle of a pandemic when a lot of people aren't in offices, and you might have to wait weeks or months to see somebody at a physical location. And if, let's say, somebody were just raped and they wanted something to...
Can we vote?
Yeah, okay. Yeah, all right, let's do that.
Okay.
Call for the question. Okay. I think we should. Do we want a roll call?
Just do it orally and then see. Anybody calling for a roll call? Okay.
Okay.
How about voice?
All right, come on so we can move forward. All right, if you're in favor of this amendment, let's just raise our hands. Is that okay? Okay. Okay. If you're opposed, raise your hand. Okay. Okay. All right. So we voted for the product that Patrick put before us, and we voted this down, so I think this is ready.
This, so you have to move the bill as,
Yeah.
move the.
Move the
as
bill.
amended.
Move the bill.
As
Move the
amended.
bill as amended.
All right. All in favor, please raise your hand. Let's save some time. We got a lot to do. All right. Thank you. Do you want to deal with this now or wait until? You want to deal with this now or wait till? But I think we got so much stuff. Okay. We got, okay, let's finish up with Patrick. Let's finish up with Patrick, and then we'll do that next. Okay.
So the next bill is Senate Bill 112. This was on the voting list, I think, last week, and then was just deferred for this week in light of some amendments that were being offered and potential discussion today. This is the bill that makes revisions to the Personal Information Protection Act. You'll recall this is the bill in state. This is the law that requires businesses to protect personal information and provide notices when there's been data breaches. So Senate Bill 112 expands and alters the act by requiring businesses that collect genetic information to maintain it securely, shortens the period within which certain businesses must provide required notifications to consumers after a data breach, and requires the provision of additional information to the Office of Attorney General after a breach has occurred. More specifically, it alters data breach notification procedures by requiring a notice within 45 days after the business discovers a breach, instead of within 45 days after the business concludes an investigation into whether the data is likely to be misused.
Patrick, where are you at the moment, right?
I'm sorry, I'm reading a summary of the bill, and I can go through. Okay.
And everybody knows we're looking at Senate Bill 112. Okay.
If under the bill, if a law enforcement agency is involved in investigating a breach, a business has to provide notification of the breach within 7 days instead of 30 days after the agency informs the business that the public can be notified of the breach. The bill also shortens the period within which a business that maintains data as a third party must notify the business that owns or licenses the data of a breach. That notification must be given within 10 days of discovery of the breach. The bill alters the circumstances in which substitute instead of direct notice. So like substitute notice would be posting something on a website or presenting a notice in some type of publication, media publication. It also alters the circumstances in which substitute notice may be provided to an affected consumer. Substitute notice may only be used if the business does not have sufficient contact information to give other forms of direct notice. The bill repeals a provision allowing substitute notice if the other forms of notice would be cost prohibitive. Under the bill, notification must be provided to major print or broadcast media in geographic areas where the individuals affected by the breach likely reside. The bill includes the provision of some additional information to the Attorney General when a breach occurs. The notice must include the number of affected residents, a description of the breach, including when and how it occurred, steps the business has taken or plans to take relating to the breach of the security of a system, and the form of notice that will be sent to affected individuals in a sample notice. So there are 3 sets of amendments that you should have in front of you. The first is an amendment requested from Senator Lee, the sponsor. These amendments that she's requesting would make the bill identical to the version to the cross file that the House has passed. And what it does is it clarifies that a business is not required to give substitute notice of a breach when the business can provide direct notice. There was, in the bill originally, that the business would have to do both, but after some feedback from some business interests who've been participating in discussions on the bill, who raised concerns about that, this alteration was adopted by the House and is being offered here by Senator Lee.
Okay, do you want to take these up separately, or do you want to, and we could vote one time maybe? Well, maybe. All right, well, let's consider the Lee amendment.
So I think none of these amendments conflict. Maybe what I can do is I can describe all three.
Okay, let's do that.
So that's Senator Lee's amendment. This next amendment is being offered by Senator Feldman, and this amendment would alter the definition of genetic data that must be protected under the Act. So the amendment would define genetic data as follows. This would include any data, regardless of format, that results from the analysis of a biological sample obtained from an individual and contains information about the individual's inherited or acquired genetic characteristics, including DNA, RNA, genes, chromosomes, alleles, and genomes. I think this is a key piece that the type of genetic data that would not need to be protected under the Act. This genetic data would not include de-identified data. This is data that cannot be used to link information to a particular individual if the business that possesses the data takes reasonable measures to ensure that data cannot be linked to an individual, publicly commits to maintaining and using the data only in de-identified form, and does not attempt to re-identify the data, unless the business is doing so solely for the purpose of assessing whether its de-identification processes satisfy these requirements, and doesn't use or disclose any of this re-identified data during the assessment process, and destroys any re-identified data on completion of this assessment. Sure.
I'll let him finish, but can I just interject? First of all, I didn't write the verbatim language here. So currently in California law, in their privacy laws, this is their definition of genetic data, and they have their own breach bill they're about to pass. And this is the language I'm told is about to go on to the California, which will be, quite candidly, the model for the country. So I'm trying. Basically, this amendment is conforming definitionally this particular, and correct me if I'm wrong, with what is going to be in place, what is already in law in California privacy-wise, but will be incorporated, as I understand it, so that we're in line with what will, again, likely be the model provision, definitionally at least, for the country at that point. But again, I just want to interject that. And you, Patrick,
Okay.
you can weigh in, or just
Sure.
that's
I'll just finish up with this, I guess, an abridged version of this. The genetic data would also not include a physical biological sample or data that's collected or used or maintained or disclosed for scientific research purposes.
Everybody's got to hear you.
For scientific research purposes, this amendment is being supported by some of the entities that are like 23andMe and Ancestry.com. They've requested this definition of data to conform with this language that's in a California statute that relates to privacy protection. I think one clarification potentially is that the California data breach law, I think it's currently pending whether this language will be included in that
Just to
statute.
be clear, the California breach bill is not yet passed. I know that this is the proposed language, so I just want to be clear that that has not actually passed.
Okay. All right. And then you got the Jennings amendment.
And the Jennings amendment addresses. Oh, go ahead.
No, go ahead.
Okay. The Jennings amendment addresses some the notification requirements that apply when there's a law enforcement or national security investigation. So if you go to the reprint connected to his amendment, you'll see on page 5 of 8 at the top that current law allows for delayed notification in this circumstance. And the way the bill has it is that essentially once the law enforcement agency gives the green light that the data breach notification can go out from the business, it has to do so within 7 days after this determination. And I think some business entities, LexisNexis in particular, was concerned that this time frame was too short. So the amendment here would say that if a law enforcement investigation relating to the breach of the security of a system precludes a business from conducting its own incident assessment necessary for meeting the notification requirements of the bill, the business doesn't have to meet this time frame of 7 days, and instead has to comply with the notification time frame requirements that normally apply, which is 45 days after the business begins its own incident assessment if it's the owner of data, or 10 days after the business begins its assessment if it's the maintainer of data. So that's the amendment that Senator Jennings has offered, and I think the position of we definitely know that the position of the Attorney General's office, who's the proponent of this legislation, they submitted a letter requesting that the committee reject the amendment that Senator Feldman has offered dealing with genetic data, and I don't have a position for them on the Jennings amendment. The Attorney General's office submitted a letter urging that the committee reject that amendment.
Did
and
they
I think
give their? All right, wait a minute. Did they give their?
Yes, they gave their reason. I think the main reason is that they think that genetic data can be. They don't like excluding.
Guys, we got a lot to do tonight. If we could try to focus. Okay.
Their reason is that they don't like the exclusion from the protected genetic data, de-identified data, because their position is that genetic data de-identified can be relinked to an individual, and so that they don't think that offers sufficient protection. That's their position.
Okay, well, maybe we could leave it from there. All right, Senator Reedy.
I was going to ask, can we just, this doesn't seem like a bill, you want to hold it? Well, I was going to say, this doesn't seem like a bill we can't do without for another year. It's a lot of work, and we got a lot to do, and I would just love to, I was going to maybe make a motion, but maybe I should just ask to hold it instead.
Well, the thing is, you're right at the point in time when telehealth is becoming largely so mainstreamed, and you need rules and regulations and to know what Medicaid is going to cover and what's going to happen.
This is on the Libra. This is data breach.
Yeah. Oh, yeah, I'm looking at the wrong one. Yeah, data breach.
Down on the bill.
All right, Senator Bottom.
I was just going back and looking at the committee testimony. There was a good bit of
Can
opposition
we all
to this.
speak up?
There was a good bit of opposition to this bill in our testimony that wasn't necessarily addressed by the amendments, so I just bring that to the committee.
All right, Senator Kramer, is your light on?
Well, I think I just heard a motion. Did I hear a motion, Senator Benson? For what? To hold it. I thought, yeah.
Hold it, I agree with
Oh, it was Senator Klausmeyer. Well,
but I agree with Senator Reedy.
so you got a motion and a second.
Okay, what is the motion?
Table it. Lay it on the table. Hold it.
Would you let one person speak at a time? He had the light on. Now, what is?
The committee's pleasure. I'd be fine to move unfavorable. I'd be fine to move to hold it. If we prefer a hold.
So what are you recommending?
I'll hold it. I'll move to hold it, Madam Chair. I move to hold the bill.
All right. Do we have a second? Okay, everybody okay with that? Okay. Yeah, okay.
I've been asked to interject to address the status of Senate Bill 31. You can find a reprint that I'll be discussing at the very back of the stack of papers that has my name on it. So this is the very last reprint in your pile. So as you may recall, on February 19th, the Finance Committee voted Senate Bill 31 favorable with amendments that struck the bill and substituted a different program. After some discussion on the floor, ultimately the bill was special ordered to March 4th, which is tomorrow, with the suggestion that some compromise be attempted. After discussions with the vice chair and the chair, a set of substitute committee amendments were developed, and those amendments are what's reflected in the reprint in front of you.
Before, can I just put a little context, okay? So on the floor, and don't forget, we had a very split committee on the bill on the outtake, right? It was like 6-5 or 7-4. So when we went to the floor, I largely, opposed what Senator Washington was doing on the grounds that the PSC had opposition testimony. And we talked about that and we resisted it. But on the House side, they offered an amendment that extended the timeline by a year, and as a result of the amendments on the House side, the PSC moved from opposition, unworkable, and those kinds of descriptions to a neutral position. So when Senator Washington got up and was going to offer basically what they had done in the House, it was hard to sort of stand with this idea that the PSC was opposed because now they were in a neutral position. At the same time, she actually liked all the education stuff that we put in to the committee report, so we basically, now that PSC is neutral, it pushes off by 1 year kind of the timelines for how we're going to do it, but it does now put the onus back, as I think at least 4 or 5 members of the committee liked, on the front end as opposed to the back end. So we're taking essentially her amendments and Delegate Learman's amendments, but we're also throwing in our education provisions. It backs it a year, and I think that's a good way to approach it, and I think she's happy with it. So with that background, Nathan, I'll turn it back to you.
Well, it's actually a very good summary of the reprint, which is essentially that it takes the bill back to the form in which it was introduced. It applies Senator Washington's amendments and then incorporates from the amendments that the committee has already passed provisions regarding a new customer education program that also require OHEP to provide information developed by the PSC education program to customers. So to move forward with this, the committee would need to vote on these substitute amendments, and then the rest of the process would be handled on the floor.
Okay. All right, we've got a motion. Can we get a second? Second? Oh, okay. All right, all in favor, please raise your hand. Okay. Did that pass? Okay.
Just a question for the vice chair. So are these what I understand is PSC was neutral with the Learman amendments in the House. Is that what this is?
Correct. So these are the Learman amendments plus our education amendments. And which the main thing about the Learman amendments would have been is this pushing it out by, I think, 1 year instead of it being 2022. And Nathan, correct me if I'm wrong, we're now talking about a program that doesn't start until January 1st of 2023, which gives the PSC now 1 additional year to develop this pre-approval program as such. But yes, these are the Learman amendments that now are neutral PSC plus our education stuff.
So we're going now back to a pre-approval position where the PSC is now going to have to not approve suppliers, but approve their rates?
No, it's in order before they, as I understand it, before they can put out in the marketplace these offers, Nathan, they're going to have to get a pre-approval from the PSC. Again, a process that will start in 2023. Now they're going to have to do some regs, and they're going to have to. But one of their main objections, the way we took it out, was it wasn't workable in large part because they were going to have to spend a year to do regs and to develop things for evidentiary hearings and all that stuff. So with that change in the House, they pulled back into neutral. So again, we can't really argue that the PSC is opposed or they say they can't do it, which was, again, the core of our resistance on the floor. So anyway, you may not like that, but that's where, where we're at.
I'm hearing a little bit different, so that's only my concern. But I just then want to get back to then what the bill does. You know, whether or not the time frame allows for PSC to approve rates, that's not what PSC's responsibility is right now. That their responsibility is to approve suppliers, and they have an application process to be a supplier into Maryland, has a bond requirement with it as well. Is this requiring now, even though it's an extended period of time, that PSC is going in and approving the rates of third-party vendors? Because that's
Looking at the language,
we're back to then a regulated supply market, if that's what we're doing.
Okay,
So at the top of page,
Yeah.
I'm sorry, Vice Chair.
No, that's what I'm saying. Go on, Nathan.
At the top of page 2 is the relevant provision here, which is that the commission by regulation or order must establish a process to approve supply offers for electricity or gas for households that receive energy assistance, and that process has to now take place before January 1 of 2023. So there were two principal objections from the PSC. The first was 2022 versus 2023, and then the second objection was in the middle of page 3 in striking subsection E, which had required the commission to create these test cases. They also said that process was unworkable. So with those two changes, it's been explained that the Public Service Commission is now neutral on the bill.
So the PSC now will be approving rates that must be used by any consumer that's on energy assistance?
Yes, pre-approval of the supply offer that will be what is offered to individuals who receive energy assistance.
Okay, so they're back to, in a sense, regulating at least that section of the energy supply market, right?
Yes.
I mean, we're in a deregulated market, but we're going to regulate that part.
But what we have were people really treating them almost as if they were in slavery. They're ignorant, they're being bamboozled, and they're paying more than they should.
I understand that part, Matt. I'm just wondering how this actually works out. Yeah.
Just two things. Number one, just to remind everybody, we're only talking about folks on energy assistance. So this is not for the broad, And secondly, when we put the bill out on the floor, we specifically said there that these folks can't offer someone less, it has to be less than standard offer. I mean, we were already had on the that's somewhat, I mean, it's on it. So when you talk about
but that was
an
on
offer,
the back end.
Well, I get that, but this is approving an offer that they need to make. They're basically saying now we're not going to let you make an offer unless we can be assured that in fact it's less than standard offer. In that sense, it's not that materially different than what we did with you're right, it was the back end, but it's still, we said there, you a third-party supplier cannot make an offer less or can't get somebody into a program. I mean, that's not free market, that's us telling them in a statute what they can charge. It has to be less.
And especially is that the rest of Maryland is paying for it.
No, I agree with a lot of the concept from a fiscally responsible and conservative position. We don't want to be spending a lot of energy assistance money on higher than normal rates if we don't have to. I'm just concerned about how this is actually implemented, that if somebody does go and tries to sell a third-party supply to somebody, they then have to know if they're on energy assistance or not, and then can only sell them a certain product, or once they sign up, the utility then has to contact them and said, hey, you sold them something, they're on energy assistance, therefore they cannot sign up to the, that's the question. I'm not understanding if this is done on the front end.
Senator Augustine, Senator Bidle.
All right, so I just want to say that this is actually not a unique product. There are other states that are already doing this. New York has a program, Massachusetts has a program. this is not rocket science. I mean, they know how to do this.
Who's
okay?
they? I'm sorry, who's they?
The companies surely know how to create programs and pricing that they could sell. They do it in other states already, where they know that they have a restricted class that they have to sell to. They have to identify it. They have to know it. They're already doing this. This is not some novel concept that we are trying to do here in Maryland. It just isn't. I mean, other folks have that. They have this provision. If someone is receiving energy assistance, that they have to be offered a certain product. I mean, that's all that we're doing here. And by the way, we voted for this last year. Now, you didn't vote for it last year. I understand that. So, but this committee did. This committee voted for this last year.
Right, and I appreciate that. I'm just trying to figure out how it works. I mean, there's a difference between what the bill we had on the floor was, that if you ended up on energy assistance while you had a third-party vendor, then the PSC would evaluate and force them to put you on a plan that is at or better than standard offer service, which I agree with that part.
Right, and I disagree with that.
Right, I'm not sure I agree with the Public Service Commission now evaluating all these programs and setting rates for different programs, because that's more of a regulated market on the supply side.
I guess I don't interpret, I mean, this bill, when I look at page 2, Senator Hershey, it's just saying they have to supply, approve a supply offer. I mean, on the front end before it goes out in the marketplace. I mean, to make sure that in fact it does what we're saying they need to do, which is come in under standard offers. I think you're overreading this into the broader deregulation market when we're talking about energy assistant folks, but.
Hey, Senator Bottom.
I have a really simple question. Does it say on your utility statement that you have the energy assistance? Does it say it right on the statement? How does the supplier know that you're on energy assistance and they need to? They shouldn't be making a different decision for every person whose house they knock on the door of. When they know what energy assistance will do at the max, they shouldn't be selling above it, that's all. And so the bill says about supply offers for electricity or gas in households that receive energy assistance. How do they know, or how does the PSC know that a person that's got one of these offers is on energy assistance?
The point is, if they don't sell it for higher than what a person on.
Wait a minute, everybody's talking
All
at
right,
once.
Augustine.
I'm sorry, I was just saying that the utility knows in the same way that in order for them to sign somebody up, they have to get that information, right? And they have to collect that. That's a part of the process right now. They know. I mean, the utility does know.
Okay, so they're going to check every application to change carriers to make sure that it's not someone on energy assistance.
No, we're not saying they're going to do casework on everybody's application. They will establish what is the most they can do based on people being on energy assistance.
I don't think that's what the bill says, Madam Chair. That's not what the bill says.
You're right. Pam was right.
Senator Hayes.
No, the other option, and one of the agencies that work very closely with the PSC on these energy assistance issues is the Maryland Department of.
Remember, the public is listening. We want to.
Oh, I'm sorry. Yeah, I think it's the mess, and I apologize, Madam Chair. But one of the agencies that the PSC work very closely with is the Maryland Department of Human Services, who has access to the information and can easily identify everyone that's already on energy assistance. So I would imagine as an administrative function, because the department already works with the PSC quite closely on identifying people, low income customers, that's a way, as opposed, I don't think that it would be appropriate for them to do on a case by case. That would be too burdensome to obviously the PSC.
Okay, are there other questions, or do we have a motion?
Okay, I'm going to move to adopt these substitute amendments, and that's what I would say.
All right, we've got a motion and a second. All in favor, please raise your hand. All right. That carries. Jennings and Hershey didn't. Okay. All right.
So back to the voting list. Senate Bill 359, Senator Rosa Pepp's bill relating to
The hands accepted the amendments?
Oh, yeah, we did. And we called for everybody to raise their hand. We can revote, just to make sure we're clear. Oh, yes, you do. We need your vote.
It's moving out. I didn't know if there was a
We
formal.
asked for everybody to raise their hands. Maybe you
Okay,
would just.
if that was on the bill as amended, that's fine. I didn't know that that's what the motion is.
Okay, so let's just go through that again, and Senator Klossmeyer is back in her seat.
Move the bill as amended.
So we moved the bill as amended now.
There's no bill. The bill's out on the floor. These are substitute amendments.
These are just substitute amendments for a bill that's on the floor. All right, are we clear what we just did? Okay, the bill's on the floor. We just did the substitute amendments. Okay. All right. All right, now we're back to Patrick.
So Senate Bill 359.
All right, come on, let's pay attention.
Senate Bill 359. This is the bill that that requires the Department of Transportation to develop a plan to replace trees that are removed during construction of the Purple Line project. Senator Rosa Pepp has worked with the Department of Transportation to address some concerns about how this program would be structured, and the way that it's that the amendments would establish the program would require the department to develop an urban tree program to replace trees that are removed during the construction of a transportation facility project, including the area impacted by the Purple Line project. So the tree program doesn't just apply to the Purple Line; it applies to all of the modal, all of the transportation facility projects under the Department of Transportation and its modal units. By doing this and adopting some of the modifications to the program here, it addresses a concern that the Department of Transportation raised, that they'd have to do a NEPA study. So it brings down the cost of the program, and the Department of Transportation submitted a letter indicating that they think that the cost per acre for replacement of the trees is roughly in line with what they are budgeting for.
Move favorable on the bill.
Second.
As the amendments.
On the amendment, okay. All right, it's been moved and seconded.
Madam Chair,
Yes, Senator Reedy.
so it addresses, it's not $1 million fiscal note anymore?
Correct.
And their letter where they said they're already pretty much replacing trees anyway, but they're replacing them in other places, this would allow them to place them in the urban center.
Yes, so that's still going to be a focus of the program is to replace trees that have been
As best they
displaced from
can,
Purple Line.
as best they can.
Right.
Okay, thank you. I just was concerned about that fiscal note. Thank you.
Okay, thank you. All right, where are we now? Okay, all in favor, please raise your hands. Okay, that looks unanimous. Thank you very much. And let's move on.
Okay, the next bill is Senate Bill 580. And this is the bill that prohibits a homeowner's insurer from considering a claim for a weather-related event for the purpose of canceling or refusing to renew coverage for a policy if the claim is for an amount of loss that's less than the insured's deductible under the policy or resolved with no payout to the homeowner by the insured. The House has passed out the bill with an amendment, and the Senator Kagan, the sponsor of the bill, is offering an amendment that would align the Senate bill to the bill that the House passed out, so that you can see on page 2 of the reprint. This would state that an insurer may not consider a claim for a weather-related event for the purpose of canceling or refusing to renew coverage if the claim is for an amount of loss that's less than the insured's deductible under the policy or resolved with no payout to or on behalf of the owner by the insurer. And I think this was just a requested clarification so that that would include like payments to some type of,
Remember they
water company or repair vendor.
Senator Vital.
I'm sort of disappointed this already came out of the House, because getting insurance in areas that are in storm areas, wind areas, coastal areas is already very, very difficult. I mean, you start limiting insurance companies on how they can cancel a policy that's had multiple claims, you're really dealing with big issues. Allstate pulled out of New Jersey, State Farm pulled out of Delaware. People in Delaware can hardly get a homeowner's insurance policy. And so I just have concerns that we are kind of overreaching on issues like this. But it's already passed the House, so I'm not sure how we want to handle it.
Well, Senator Feldman.
Can I just, I guess as a threshold question we should always ask, I always ask myself on any bill, has the sponsor presented a problem sufficiently large in our state, that we need to act, and does the bill resolve that or have unintended consequences? And I have to say, with all respect to the sponsor, she cited to her constituent one guy who then had an appeal who got his insurance reinstated. Now, I think there was like 4 or 5 other cases in the entire state of Maryland. So as much as I appreciate like you had a constituent issue that got resolved, and therefore that generates a bill, I'm not sure that rises to the level of, like the state needs to take action. So I guess I would just look at it kind of like that. And I am a little surprised that ECM moved so quickly on this, but that was how I would look at this particular bill.
So is there a motion?
JD.
Do we have a second?
Who seconded?
Who did? Did someone second it?
Reading.
Reading. All right, let's raise your hand if you support the motion.
He does.
Is this on the unfavorable?
Yes.
Unfavorable.
Unfavorable.
I was for the bill until the vice chairman spoke.
Okay. What you want? What you doing?
Just really.
Okay. All right, so it's unfavorable. Senator Battle, I do think your advice was sage in this case.
Only in this one. Only in this one. That was only.
Okay. Come on.
Thank you for your guidance, Vice Chair.
So next bill. So the next bill is Senate Bill 638. This is the bill that relates to the insurance commission, the insurance commissioner MIA's ability to enforce the clean claim law of the insurance article with respect to the Medicaid ASO, in this case Optum. Senator Augustine is offering an amendment in the reprint based on some feedback from the insurance administration. The amendments would make clear that the provisions that would require the ASO to pay interest on unpaid claim. There's a provision in law that requires the payment of interest on clean claims that are not paid in a timely manner. This would make clear that that provision applies to the ASO as well. There's also an amendment that would apply the penalty provision in the clean claim law to the ASO, and language that would establish that the ASO is subject to provisions that enable MIA to conduct a market conduct examination of an entity for an investigation of potential violations of the clean claim law.
Okay. Senator Kramer?
So this is the Optum thing, and will this put teeth into it then so that MIA can actually take action And not just say you're doing a lousy job, but maybe start getting results out of them so that, thank you for that, Senator Augustine, you're brilliant.
Okay, so did someone,
Favorable on the amendment.
before we do that, we've got some requests for response amendment. Anybody else want to
I
sign?
think we should all join with
Okay, if I'm not on.
Full committee.
You want to be on? All right, does everybody want to be on the bill? Okay, all right.
And I move favorable on the amendments, Madam Chair.
Second?
Okay, it's been moved and seconded. Any discussion on the motion? All right, all in favor, raise your hand. Yes, on the bill as amended, yes. All right, that's unanimous. Okay, thank you.
Chair, the next bill's mine. I want to hold it.
Okay,
Issues come up on the next bill.
okay.
We're going to hold that. Hold the bill. Senate Bill 35. It's mine.
Let's go to Senate Bill 107. If you recall, this was up last week and it was held. And so you should have two documents in front of you. You should have a thick reprint, and then you should have a single-page document that says Senator Hayes substitute amendment on. I'll get to these in a second. I'll refresh your memory very quickly. This bill, Senate Bill 107, requires a covered employee who is a non-exempt employee under the Fair Labor Standards Act working 50% or more at a Maryland heightened security location, which in the bill as introduced would be BWI Thurgood Marshall Airport, Penn Station in Baltimore, and the Port of Baltimore, to be paid a specified wage by an employer located at one of these three facilities. So if you go into the reprint in front of you first, there's a large set of amendments offered by Senator Hayes. Most of these you saw last week. There's a couple additional ones, and then there's a modified amendment from Senator Beidel in this reprint also. So again, starting on page 2, there's a series of technical amendments because of bad drafting by me, not putting this in the right section of law because there was an addition from a veto override. If you go to page 3, you'll see that these employees are going to be exempt from the wage and hour law, which applies minimum wage standards to Maryland workers and employers. Senator Hayes on the bottom added language regarding the tip credit under the wage and hour law, and this would exempt those employees specifically at these heightened security locations from the tip requirement under the wage and hour law. If you go to page 412 of the reprint, this is the first of Senator Hayes' amendments to the actual requirement that these employees at these locations get paid a certain wage. Covered employee, as I said, is somebody who's an exempt employee from the Fair Labor Standards Act. Senator Hayes adds that a covered employee does not include an individual who performs work at one of these locations in a retail establishment, food service facility, or an on-airport, off-airport motor vehicle rental company or any other company involved with motor vehicle rental operations. Senator Beidel also has an amendment that would say a covered employee is not an employee who receives wages or benefits under the terms of a collective bargaining agreement in place on or before January 1st, 2021, or a successor agreement. Further on down the middle of the page, where you see another number 2, Senator Hayes also offers that an employer does not include an employee that provides construction services as defined under the part of the law that governs employee misclassification. Further on down, an additional amendment strikes the Port of Baltimore from the bill. So heightened security location with these amendments would only be BWI Thurgood Marshall or Pennsylvania Station in Baltimore. Moving further into the bill, there are no other amendments until you get to page 6 of the bill. And as you see, there's Senator Hayes initially offered that this new wage wouldn't take effect until January 1st, 2023. Instead, if you go to the single page, he would replace A1 and 2 with this phase-in and it would not be a reference to the Guard 1 classification, and instead would specify a series of wage increases till 2016, I guess that's 5 years from now, over a 5-year period. So starting in January 1st, 2022, the wage paid to these covered employees would be $13.50 an hour. And then January 1st, 2023, that wage would go up to $14.25 an hour. A year later, it would go up to $15 an hour. A year later in that, it would go up to $16 an hour. And then January 1st, 2026 on, it would be at least $16 an hour. But the employer would have to pay a covered employee a supplement valued at $1. The supplement, and we're still working on drafting this, the supplement could be accomplished in either three ways: in the form of health or benefits, not including paid leave that cost the employer the entire dollar, or a portion of that dollar towards health benefits, and the rest in cash, or just another dollar in cash. So the employer would have the option of paying one of these three options, and I believe this was worked out with the employees of the airlines, who would no longer. Senator Bidel initially offered an amendment that would take all the airlines out as employers. This was worked on with Southwest, who's a major airline at the airport, and those employees who are not covered by collective bargaining agreements would be covered by this phase-in. In fact, all the covered employees at the airport who were subject to this would be covered by this phase-in of the wage, rather than subject them to the wage, the Guard 1 classification under federal law. And then if you go to there's no more amendments after that until you go to the end of the bill, end of the reprint. And that starts on page 12. And I should strike, I guess with this here, you no longer need number 2, section 2. I forgot to take, this was done before I got that. So you no longer need new section 2, because that would have moved everything back if COVID was still going on at that point. So that's not necessary anymore because of the phase-in over till 2016. And a new section 3 is added, and this requires the Port of Baltimore to study the difference between the wage rate, and that's going to have to be altered also because it's no longer Guard 1. So we'll have to say that the port has to study the difference between the wages paid to their employees, and I'll have to come up with some number, talking to the senator on how they want to compare those wages. And then they have to compare their wages and benefits to the Port of Baltimore with Norfolk International Terminal in the Port of Virginia and the Port of Philadelphia, and they have to report back to the General Assembly at the end of January, or no later in January 1st, 2022, on their findings. And then there's an additional language attached to require the Maryland Aviation Administration to do the same type of study regarding their employees and that are exempted, that would be exempted from the bill, and then the wages paid to the employees who are covered employees, and they would also have to report back no later than January 1st, 2022. So I would have to, in light of if you adopt the senator's substitute payment method or wage amendment, that uncodified language would have to be altered to recognize that we're no longer dealing with Guard 1 classification wages, but this phase-in wage period.
Move favorable on the Senator Hayes amendments.
All right, we've got a motion and a second.
Can we discuss now? This is appropriate time to discuss. I love my colleague from Baltimore City, but I don't love this bill, I have to tell you. And so I tried to take out the airlines last week when we had the bill, and it was discussed, and they weren't taken out. We didn't take them out, and now we're taking the port out, but the airlines are in. So I got screwed on that. But I can tell you, I just received an email just before we started tonight that Allegiant Air, Frontier Airlines, Spirit Airlines, Sun Country Airlines, none of them support the bill. They're very concerned about being competitive with Dulles, Reagan, and Philadelphia. And that's what makes this airport so successful, is we're financially so competitive. So I appreciate that we got a study in here, but I just feel like if it's not good for if it's not good for the port, why is it good for the airport? Thank you.
Okay, Senator Hayes.
Madam Chair, and likewise, I honor and adore my colleague from Anne Arundel County on the last bill when dealing with insurance because of, I know, her longevity and expertise. I looked up to see what direction we should go. But no, in all seriousness, we've done a lot of work on this legislation, and as Senator Benson often say, this one is really for the little people, right? Those individuals that throughout this entire pandemic that showed up to work, cleaned bathrooms and did all of the things that they needed to do. This is the third year we've introduced this bill. I've been on the phone Saturday, Sunday, Monday, Tuesday, all of this week, going back and forth. We've eliminated a lot of people that was originally included in the bill, from food service workers to construction workers to, there's been a lot of compromise going back and forth. But I think we definitely owe it to those individuals that sat at that podium and talked about the difficulties in transporting back and forth from work to home and having to get second jobs and get daycare and all that other stuff. I hear what my colleague is saying, but it's really, really important that we provide an opportunity to lift these people. And so I ask that we honor the motion to pass the amendments as I presented them to you with the amendment.
Mr. Nair, if I understand, we're dealing with the janitors and the wheelchair pushers and those people everybody else has given nothing to. Senator Hershey.
Yeah, thank you, Madam Chair. Real quickly, Senator, why was the port taken out?
So that's a really complicated issue right now. There's a lot of negotiations going on around a major project, Howard Street Tunnel and other things. They were taken out as being covered, but they weren't taken out as being, we're going to study those positions and see what the comparison is. But as you all know, I think there's a huge commitment on behalf of the state right now for some expansions going forward. And so we want to look and make sure that the port remain competitive.
2 pages. Yeah, you're making it sound like you don't want them to be at a competitive disadvantage.
Right,
But
absolutely.
it's okay for the airport to be at a competitive disadvantage with Dulles, as my colleague just wrote?
So the amendments that are proposed on the very last page was a compromise that was struck with the major, the largest and anchor tenant of the airport.
Just one, which
Right.
is Southwest.
Also, and thank you for bringing that up, Senator Hershey. And to my colleague's point, so as you guys look in your floor laptop at all of the testimony, none of the airlines presented, not in the last 3 years. Actually, the lobbyists that represent them, except for the largest tenant at the airport. If you go to the ethics log, the lobbyists for those other airlines that were named just registered today for the very first time after 3 years. They've never weighed in on this issue ever before.
Okay, can I just, another question, because you mentioned, here's my issue. We talk about this being a heightened security bill, but then you mentioned, or my chair just mentioned janitors and, I mean, I'm not even sure who's affected by this bill anymore. There's so many people, the retail's out, food service is out, construction's out. Who's is affected by this anymore, and what is their role in security?
Right, and so heightened security areas are typically those areas in which you have to get beyond TCA, and you know, when you're at the airport, when you have to get beyond TCA, not the people that you could just walk up to, but they're in secure areas that require certain credentialing to be in those areas because you have access to the planes and other very sensitive equipment that it takes to run an airport.
Okay, so of those people that are on the other side, that don't work in retail, that don't work in food service,
That don't work in construction.
and don't work in construction, who's left?
Right. So you have I think as already described, you have the hard-working men and women residents of the surrounding area that go to work every day. I don't know if you guys remember, well, no, but these are the individuals that if an individual need assistance in getting through the airport, through the wheelchair or whatever, they're in that secure area. If we've had some type of attack or whatever, they would be in harm's way, obviously, because it's, the main protection we have is the TSA. But these are people in the heightened security areas within those different.
I thought initially, didn't it also include the people that clean the bathrooms?
Right, yes.
And none of those people are in unions, they're just subcontractors to contractors that perform
Most of them are
works?
contractors.
Most of them are contractors? And this would not affect the contracts that are currently in place with?
I'm sorry?
So this does affect the contracts that are currently in place with the airlines, or with the
Yes.
airport?
Yes.
But that's Senator Beidel's amendment. You've made the motion on Senator Hayes' amendment. Senator Beidel has a separate amendment concerning existing collective bargaining
Okay,
agreements.
I thought they were all complete. All right, thank you, Madam
All
Chair,
right,
thank you.
Senator Jennings.
So, going back to the airlines, I got the letter that Pam brought up, Senator Beidel, but also, I got American and United, the majors are starting to weigh in on this thing. And you say the TSA. So did you look at all the airports of the state that have TSA? Did you look at all the airports in the state that have TSA?
So all of the airports in the state, the ones that you referenced just weighed in today for the first time in 3 years.
I'm talking about airports now, because you're saying high security areas.
Yeah, so our neighboring airports like Reagan and them, they've already they've already provided additional wages above and beyond it. They're ahead of us already. We're the ones that's lagging behind here in Maryland.
I don't want to open a can of worms because it's
right,
going to upset people, but there's other stuff that, I don't know. I just find it is Senator Hershey said that you're not bringing a port into it. You've taken them out because of a competitive disadvantage for the Howard Street Tunnel and other stuff. But here we are doing this to BWI.
Well,
So,
you're not really
it's hypocritical.
done.
Yeah, the port isn't completely out of it. Is the study? There's a study. Just as all of the other people that was taken out of, we're still studying what it is in comparison to the other places around us.
And so the last one I have is the baggage guys, when you pull up and you drop off your bags, you tip them. Have we consulted them? Because they get a raise, they're not going to get as many tips. They might not like that.
I think they've taken that thing into consideration.
Okay, Senator Kramer.
Yes, thank you. Committee, I think we have lost sight of a very important piece of this legislation in that these are employees who are working in secured areas. So the intent here is to pay them a wage that provides certainty and consistency in these employees keeping these jobs that may range from non-TSA security, terminal cleaners, cabin cleaners, line agents. We've mentioned wheelchair attendees. These are people who are in high security areas. And turnover because of low wages in those areas of our airports puts everyone at risk. And that is one of the foundations of the legislation before us, because it is in everyone's best interest to have stability and quality of employees in these high security areas. So in this day and age of real concern about terrorist acts at our airports and the knowledge of, hey, minimize the turnover, that's critically important, and that's at the heart of this legislation. So I just wanted, that's something that has not come out in the conversation. Thank you, Madam Chair.
Thank you. All right, Senator Bidle and Senator Hershey.
This is real quick. I just heard from the director of the airport. The janitors are hired by Maryland Aviation Association, so they are not part of this bill. They're part of the MAA.
I don't know who the bill's for, but to Senator Kramer's comments, did these contractors come in and say they were having difficulty keeping their employees hired because they weren't offering good enough wages to keep them hired, and then they needed us to come and make them raise their rates so that they could keep people? Is that how the conversation went?
I have not had conversations with any contractors.
Oh.
Common sense would dictate, and we have heard from other previous bill hearings on very similar subjects, that yes, the turnover rate is very high, and so yes, common sense would dictate
That they would raise rates
an
on their own to
appropriate
keep those
wage
employees.
will help secure solid employees.
Why wouldn't they do this on their own? I just wonder how come this is so, so outside the box that you've been able to figure this out. But these contractors haven't figured out themselves that unless the state stepped in and mandated they raise the rates, that they could just do that on their own if turnover was such an issue.
And perhaps they're not concerned about the turnover. However,
you are.
Yes, because if I get on an airplane, I want to know that security is
TSA?
at a high level, and I don't want to have somebody bidding on the cheap to provide jobs in secured areas, having bid on the cheap. So yes, there is an absolute value to ensuring that, once again, we don't have a race to the bottom, but that we are paying wages that will ensure in high security areas a level of comfort for our traveling public. That's all.
Now, maybe, Madam Chair, we can get a list from the airport of all these security breaches that my colleague has mentioned that has made the airport so unsafe that this is necessary. They might have that information available.
Let me just say, I have a slightly different take as to why I'm interested, and then call on Senator Reedy. The people we're talking about are essential workers who are very lowly paid doing jobs that most people won't want to do. And in the middle of a pandemic, we certainly need people who are doing the sanitizing in the restrooms and places like that. But they are included in this bill, and I just think that's very important. We don't want people who must work and do work that most people don't want to do, and which is absolutely necessary for our health and safety and the traveling public at a time of a pandemic. Senator Reedy.
Thank you, Madam Chair. So I just listening to this dialogue, number one, we have a fabulous airport at BWI. It's beautiful. I'm always happy to go in there. I'm not a huge fan of being at airports, but BWI is a great airport. I have not seen or heard any evidence that there's any trouble, as Senator Hershey talked about. But number two, the question that's being asked is, what are these jobs? I've heard some of them, but we're talking about the security and safety and the cleaning. Again, you have to have it at some level of the market setting rates for what people are paid for the job they are doing. And I am pretty sure you're going to be making more working in a secure area than you would be working that same job at a different location that's not a secure area. But to me, it just doesn't make sense for us to have government coming in and picking a relatively small group of categories. And we're talking about security. These aren't TSA agents. They're not the ones on the plane. They're folks who are operating, taking people, escorting people in wheelchairs, which is doing janitorial work and cleaning work. All of that is important. There's dignity in all work, and every job is important. But they're also, you have to allow a certain level of market force to set the rate of what you're paying. we're not, I originally thought this bill was like paying everybody at the airport more. I'm kind of glad it's not, because that would have its own set of problems. But I think that we're going a little too far here. This is a bridge too far.
What, if somebody wants to make a motion, we need to vote something up in there. All right, then, all in favor, what is the motion?
Was a favorable motion that was seconded to adopt the Hayes amendments.
Okay. All in favor, please raise your hand.
1, 2, 3, 4, 5, 6, 7.
Those opposed, please raise your hand.
Move the bill as amended.
No, there's another amendment that was presented.
Okay. Did you say there's another amendment?
Senator, in this package, there was this amendment offered by Senator
Okay.
Beidel, too.
Okay. You gonna take us through it, or Senator Biden?
I mentioned it already. It's the amendment that says if you're not a covered employee, if you're subject to an existing collective bargaining agreement as of,
Okay.
and any subsequent agreement.
That one ought to be unanimous, I imagine.
No,
It's
no.
not. All right, Senator Hayes.
No, and like I said earlier, Senator Biden and I talked about this last week. I think this amendment has greater complications than what we thought. The amendment essentially say that if you're under a collective bargaining agreement, and as of last year, that you couldn't benefit from this. And obviously, we don't want to create any disparity amongst the employees. And so I'd ask that the committee reject this amendment. It puts employees that are working side by side together in various functions, working in the same conditions together, at a huge disparity among each other. And it just doesn't really make any sense. Now, there's nothing that would prevent the bill as amended already from, if the employers or the contractors, whatever we're referring them to at this time, if they want to increase their wages above and beyond this, there's nothing stopping them from doing that. But this amendment, with all due respect to the maker of the amendment, is just a poison pill for the rest of this bill.
Okay, Senator Biden.
Now, Senator Hayes, that's a total shock that you're opposing this, because we've talked since last week, and you never said that you were going to oppose the collective bargaining amendment. You and I talked today, and you didn't bring that up. So you talked all weekend with Southwest. The collective bargaining amendment was put in for Southwest, because they do collective bargaining. So how do they feel about you taking out what we put in last week for them?
They've agreed to the amendment we said, and Senator Beidel, like I said, with all due respect, I got a lot of respect to you, but I tried to talk to you today on the floor. You told me it wasn't the time or place. You hung up on me. We talked in the hallway, and that's exactly what I tried to communicate with you when you were prepared to receive it. That the amendments that we agreed to with Southwest in all these conversations was to substitute this amendment that you're proposing. Maybe you didn't hear that. I apologize that I wasn't effective in my communication, but it is not true that I haven't tried to communicate that to you since our
Well, the
conversation.
rest of us are concerned. And so if you're saying that people that you want to help with this bill are already under a collective bargaining agreement, you want to ignore the collective bargaining agreement?
What we're saying is we want to set a floor. So no one is getting paid beneath what we're proposing, right? So if they're under a collective bargaining agreement, this brings everybody on the same level. Now, if the contractors want to pay them more, that's fine, but we want to set a bottom line for them.
Getting too complicated.
Problem overriding a collective bargaining agreement that's been bargained. I just really, I mean, we support collective bargaining in a lot of unions in a lot of ways, and now we're going to override it with the changes in this bill. I'd like to hold the bill, Madam Chair. I need to talk with Southwest Airlines. quite frankly. They're the largest tenant at that airport. They were just built an entire new concourse for Southwest Airlines.
Right, and we've already passed amendments that Southwest has requested from us, right? The compromise that we agreed to, we've already voted on and we've already passed.
But part of
They
that,
understand that we were not going to adopt this amendment and we were going forward. And we've had this conversation over and over and over again. To hold the bill another week, we've already held it for 1 week.
All right, why don't we just hold the bill? We're even among.
Madam Chair, I adamantly disagree that we should hold this bill. I think we've come like really, really far, but what's that? Yeah, if we could just vote it, and it is what it is. I'm telling members of this committee, we have worked really, really hard. We've compromised left and right, and this is the agreement that we came up with the advocates. And if is the will to put this committee on there, but I warn you that it's definitely a poison pill for this bill.
get a message from one of the lobbyists for the airlines, and she confirmed that they're okay with the phase-in. But I did not hear you say that today. We were interrupted when we were talking, and you had to take another phone call. And so you talked about the amendment, and you gave me a copy of it, but you didn't tell me, or I didn't hear you say, that Southwest had given up the collective bargaining for that amendment. Because they have employees that are not collectively bargained too. They have both. They have.
If you read the amendments that we proposed, it accommodates them in that. Southwest, in their collective bargaining agreements,
Okay.
they offer their employees, and we had this conversation how they offer their employees health care. And so the credit, the $1, the last amendment that's on
Senator
there.
Hayes, in all due respect, this is something in my district, and it's important to me. And I'd like to, make sure that I'm doing the right thing for this business in my district.
Colleagues,
So
we've
thank
got
you for your
about
work.
20 other bills, and I think we've spent a lot of time. Why don't we not complete anything since there's confusion tonight and get through some of these other bills?
Let me just weigh in here. So talking to Dave, I don't think we're going to be able to get through these 20 bills today.
Yeah, we got to do
And I think we're probably going to come back tomorrow. I'm, as another option here, middle ground, this is not a hold. How about a hold till tomorrow when we come back here and finish up this list as a bit of a compromise? That's what I would propose, Madam Chair.
We would have to wait till next week. Tomorrow would be reasonable. Yeah, tomorrow.
Okay.
I agree with my colleague over here about Southwest and even the senator's comments that at least Southwest was here at the testimony and was concerned about the bill. How do we get an assurance, I don't know if you have it fully or not, an assurance that Southwest, I don't want to say is just, you made it sound like Southwest knew we weren't going to take the collective bargaining amendment or knew we weren't going to accept or exclude airlines. I don't know if you knew everybody's vote, but to tell them that, hey, we're not going to accept this, we're not going to do that, so you have to take this, is a lot different than Southwest saying, we're okay with this. So that's my only concern. Did Southwest accept that because you told them you're not going to get any better than this, or do we really need to have a vote on whether we want to exclude airlines or not, and let the committee members decide?
I can read the message to you that I just got from one of the lobbyists. We can't. Okay. If I can read this, we can't speak for the other airlines, but we're okay with the phase-in for Southwest. So I just got that confirmation.
Colleagues, why don't we do this? We've got a fairly short hearing list tomorrow, so we can continue voting after hearing tomorrow. Why don't we decide what we're doing on this one bill, and we've been here a little bit more than the 2 hours, and we're not supposed to stay, based on the new protocols. So can we, what do you want to do about this tonight? Senator Kramer?
Yeah, thank you, Madam Chair. So the issue with Southwest, I think, has been verified. I don't know how I heard from sources on that side of the issue that this was their compromise, not that they were forced into doing anything, but a lot of time was spent in the last 72 plus hours, actually the last week, and that there was this compromise. So we have that addressed. As Senator Hershey pointed out, they were at the bill hearing. Their concerns have been addressed. I moved favorable. There was a second on the bill as amended with the Hayes amendments. So the motion's on the floor. So.
All right, Senator Feldman.
I'll just reiterate, we're going to be back here tomorrow, and I totally understand Senator Hayes' sponsor, not wanting to wait a week, but we have, requests from somebody this is a pretty significant, very important business, and she, is asking you for some comfort in her own mind to have until tomorrow. That seems very reasonable. We're not talking a week, so I'm a little bit surprised that we're pressing it till tomorrow after hearings.
I think Senator Beidel got the
Well, I think
answer
she
to the
reiterated her
question
request
she
for
was
I'll let her
seeking.
speak for herself.
We were debating, I did get the message from the lobbyist for Southwest that they're okay with the phase-in for Southwest. She can only speak for Southwest, not American or Delta or any of these other airlines, but Southwest is okay with the phase-in.
Okay.
Okay, well, do you want to, are you still asking for a hold till tomorrow, or is,
All right.
really that's,
All right, so the bill remains before us. We've got a motion and a second. All in favor of the motion, please raise your hand. All right. You have that.
The motion is to do what now?
Pass the bill as amended. Okay.
Okay, so the no's are,
Yeah, okay.
so 3 are.
All right. All opposed, please. Okay. All right, so the bill, the motion carries. All right. Thanks for your work this evening. Let's be as expeditious as we can with the bill hearing tomorrow, because you see the rest of what we have. If you can hold on to the materials that the analysts provided for us, the rest of the rundown and the materials that are attached. So it's fine with me if you want to leave it on your desk. Is it okay over there if they leave it on there? We will, the hearing is at, wait a minute. Hearing is at 1, and then within a half hour after the hearing, we will continue to vote.
So tomorrow, after the hearing, we will.
We'll vote.